Good afternoon, everyone, and welcome to our kickoff webinar for Vermont's Preschool Development Renewal Grant. I'm going to start with just a couple logistics and an overview of what to expect today. I'm Dr. Morgan Crossman, and I'm the Executive Director of Building Bright Futures. In today's webinar, you should expect to hear an overview of Vermont's Preschool Development Grant, really in terms of the high-level funding priorities, grant timeline, the required activities, and then brief overviews of each of the projects and priorities that are listed within each activity. So you'll hear from our team of directors who helped write the grant and are responsible for overseeing our grant activities. And each of the slides that you'll see today indicates the lead for the project, so you have a sense of who's overseeing which pieces of the grant. So again, you'll hear a very high-level overview. It is a very robust amount of information. And as the projects are getting underway, there will be way more information from each of the project leads. And most of this communication will come through the Building Bright Futures website. So we'll put that in the chat a little bit later on for where to go to find more information. In terms of the logistics of today's webinar, the Q&A function is going to be active throughout the entire session, and that is the best way for you to submit your questions. And we'll do our best at the end to address as many questions as we can, but we'll also use your questions and the feedback to put together a frequently asked questions document. We will also put a range of links at the end of today's webinar to provide other ways that you can be engaged in the work and where to go for more information. So the information you're seeing on the screen right now is about the Vermont Integration Project, Birth to 5, which we are calling VIP B5. Everybody talks about the Preschool Development Grant as PDG, and we want to shift that narrative for the next 3 years and really have people be talking about it as VIP B5. And what's most exciting about this grant is that it truly was a public and private partnership. So I want to just quickly say thank you to the BBF team and the network who supported identifying priorities for this grant and supported the drafting process, and all of our different agency leaders across departments and divisions who are also critical to developing priorities and supporting grant writing. And most importantly, all of the stakeholders across Vermont's early childhood system. We put out a survey before starting the grant writing process to say, what are the priorities and needs and challenges facing the field? And we had such robust feedback helping us identify those priorities through that survey, but also through our BBF regional councils. So thank you all. In terms of the current status of this project, we are in the beginning phases of planning and implementation. So today's webinar is really about providing awareness about the different activities so that you all know what those priorities are, how to think about being involved and engaged at different parts of the project. Again, BBF will be the primary point of communication for the grant, and we are also managing several of the project activities for the grant. So if a member of my team can post a link to the PDG page and the newsletter sign up in the chat, that would be great. So what is VIP B5? Vermont was awarded approximately $23 million to think about how we best strengthen our early childhood system in the state, how we support workforce development and capacity, how we support quality and access to services for children birth to age 8. I know I said B5, but this application and the intent is really around the broad early childhood system. So Vermont was awarded $7.7 million annually for 3 years. That funding started the last day of December 2022 and will go for 3 years. And again, it really focuses on this broad system of services. It is a really amazing opportunity that shifts not just to focus on systems work, but also direct service. So approximately $3 million of subgrants every single year will go out to communities to support mental health, to support high quality childcare and early childhood education, family engagement, workforce issues, and really thinking about quality and access. The preschool development grant as a grant-making mechanism really is based on a mixed delivery system, which includes childcare, family childcare providers, Head Start, pre-kindergarten education, and home visiting. And the way that they are defining a mixed delivery system is through the Every Student Succeeds Act, which is a combination or a system of early childhood education services that are delivered through a combination of programs, providers, and settings, such as those that I named earlier, that's supported by a combination of public and private funds. And this mixed delivery approach is what is considered national best practice in terms of thinking about how we ensure access to high quality services through a range of settings that is meeting families' needs, which is particularly important in a rural state like Vermont. In terms of grant oversight, you're seeing the list of the team of directors. The Agency of Human Services Child Development Division is the primary awardee of the grant, and the grant will be co-directed by the Maternal and Child Health Division, Building Bright Futures, the Agency of Education, and the Department of Mental Health. So I want to pause and ask the team of directors to just do a brief introduction, starting with Janet McLaughlin.
Good afternoon. I'm excited to be with you today, wearing my new hat as the Deputy Commissioner of the Child Development Division with the Department of Children and Families.
Awesome. Elisa Stahlberg.
Hi, everyone. I'm Elisa Stahlberg. I'm the Maternal and Child Health Director at the Department of Health.
Janet Kilburn.
Hi there, Janet Kilburn, Early Childhood Director at the Department of Health.
Katie McCarthy.
Good afternoon. I'm Katie McCarthy. I am the interim early childhood programs manager at the Agency of Education and the Early Childhood Special Education Coordinator.
Awesome. And Cheryl Wilcox.
Hi, everyone. Cheryl Wilcox with the Department of Mental Health. I'm the Mental Health Collaborations Director there.
Perfect. So again, we wanted to make sure that folks know who is managing the VIP B5 grant for Vermont. These are the points of contact, and there will be implementation teams and a lot of different partners engaged in all components of the grant. But at this point, this is the team of directors that is managing the scope of work for the state, in addition to Don Roos, who is the statewide director of early childhood systems. Janet, I'm looking to you for that title. Perfect. So we're really excited to have additional capacity in the state for this. Next slide, please. We also wanted to take a minute to situate Vermont in the national context for these preschool development grant opportunities. And we are among an incredibly strong cohort of states who are either receiving funds to support a 3-year renewal or implementation cycle, and those are the ones with the yellow arrows. And then there's also a series of states who are just restarting their preschool development grant cycle with 1-year planning grants. So what you're seeing is that there are states across the country that are trying to tackle a lot of the same challenges and opportunities related to building strong early childhood systems, supporting workforce, and really thinking about quality and access. And this grant mechanism is a really important opportunity for Vermont to be leveraging federal dollars to support our ability to address these challenges, but also to continue being a leader in this early childhood space. Next slide. So this slide shows you an overview of the 6 required grant activities. So again, some of these federal grants are very prescriptive and say, here is the scope of work that you need to execute. It requires a continuous identification of the needs of the system and to use that information to inform strategic planning for the state and a development or an update of our Vermont Early Childhood Action Plan. It focuses on how we are maximizing and supporting family engagement and leadership in the system. There's a focus on workforce development and quality and access across our system. And the newest bucket, for those of you who have been tracking these grants over time, is subgrants to enhance quality and expand access in programs. So this is the newest of them. One of the final pieces that's required by this grant is a robust amount of monitoring, evaluation, and really thinking about how we are using our information to inform our activities through continuous quality improvement. Next slide, please. So because we know how excited folks are about the newest scope of work under Activity 6, which is funding out the door to improve quality and access, we are flipping our order and starting with Activity 6. And again, traditionally PDG and now Vermont's integration project is and has focused on systems. How are we supporting infrastructure, process, needs assessment, strategic planning? It has not been about direct service. And for the first time in PDG history, they are allowing that focus on direct service, which means we have an opportunity to make subgrants to programs, schools, communities, direct service providers, researchers. And yes, there are some stipulations around how much funding each year can be used in this way, but that it will increase over time. So I mentioned that this is a $23-ish million grant over 3 years. Approximately $3 million in subgrants will go out to programs in year 1, and there is the potential to increase that number over time. So the first project that I want to talk you through is called the Vermont Early Childhood Fund. And this will be overseen by Building Bright Futures. And we will be putting out approximately $2 million to be piloting innovative strategies and practices that are addressing key priorities that were identified in our needs assessments, in our needs assessments, but also through the priorities of our regional councils, of our strategic plan committees, and of the work that you all did to provide us feedback in writing this grant. It's a really amazing opportunity to meet some of the long-standing needs and challenges, and to ensure that we're not creating unsustainable systems. So by putting funding out in strategic areas, as you're seeing on the slide deck here, we can be piloting, but then monitoring and evaluating those pilots to determine what actually has the potential to be either scaled statewide, or where those impacts are and what's working and what's not. So again, the priorities here were developed based on the survey that we fielded before our application process, some of the federal requirements, and then again, by our Building Bright Futures network, namely our regional councils. And those priorities are access and infrastructure, expansions, staffing, professional development, workforce innovations, connecting families to services, regional needs and priorities. And what's most exciting about the Preschool Development Grant in this round is we can use the needs of our state in each year to drive what these priorities are. So sometimes those might be the same year after year, and other times we may need to adapt to meet the evolving needs. So we'll be working closely with partners to make sure we're not duplicating efforts in where we are prioritizing those awards across the system. And we'll be doing a webinar to describe that process. And there will be multiple opportunities to apply and receive funds over the course of that 3-year period. Next slide.
All right, so sorry, I had my papers in the wrong order. So this particular project is focused, all right, on support for children with disabilities and specialized needs. And it will allow us to have the funding to expand the special accommodation grants that we offer. But it also will support us to investigate how we can improve how those grants are structured, how the payments are administered, and to look at, if there's other, what other tweaks and adjustments we can make to support equitable access to services and education.
It's really exciting for me to be able to talk about some additional supports that will be going out for families and young children. So, interestingly, similar to what Janet was saying about special accommodations grants that already exist, we have consultation for early childhood and family mental health, but this will allow us to put out a request for proposal for more consultation. We know that early care and learning sites, children have, were home during the pandemic, are struggling, that folks that work in these places really need support and education, and for folks to wrap around them. So we'll put that out as a request for proposal for folks to respond to that and get more supports out there. The other 2 pieces of evidence-based clinical practices are expanding our parent-child interaction therapy and also expanding child-parent psychotherapy. So these are both, as I said, evidence-based practices, and it really supports children and their caregivers together. So I think, when we think about therapy, it might be an hour a week, and that's time limited, but children live in their families and with caregivers, and those are the folks around them that provide their support 24/7 for their lives. So wanting to really stand that up as well. And these are supports that will be going toward designated mental health agencies, because although these are services that are clinical and can be billed to insurance, there are things like learning, training, supervision that are all a part of these therapies as well that we want to make sure we're supporting. So we're going to be able to expand and do more of that around the state as well.
Okay, so we know that supporting family childcare homes is a really important strategy to meeting the needs of Vermont's kids and families in their communities, and especially in rural communities, and that our family childcare homes are a really important element of our mixed delivery system. And so these subgrants will allow us to continue and strengthen support for the Vermont Early Childhood Networks throughout the state, and begin to look at what other services, supports, coordination, technical assistance, mentoring might be needed to support family childcare homes throughout the state.
All right, so the projects that you just heard are the very specific targeted opportunities under activity 6 of the grant, which is sub-grants out to communities. And again, as we adapt to meet the needs of communities, some of those priorities might change over time, but what you heard are the year 1 projects and proposals, as well as some that will extend into future years. So we're going to jump back up to required activities, and the first activity required by VIPB5 is either to develop or update a comprehensive needs assessment. So in the original grant in 2020, Building Bright Futures, aligned with our role in state and federal statute, developed an early childhood needs assessment to really think about how we monitor our system. And we did a range of stakeholder engagement through focus groups, surveys, and then some systematic document review and data compilation to say, here are the top 8 themes that we identified as needs in this needs assessment. And we have continued over the last few years to use this data to inform the building and development of our strategic plan, but also to inform policy, vision, decision-making, and then setting priorities and funding for future grant applications. So that was the 2020 version in the original preschool development grant. Under VIPB5, Building Bright Futures is continuing to lead this scope of work, and we're going to start with doing, somewhat of a meta-analysis, really trying to understand what needs and what has changed since that original needs assessment, and really looking across all of the federally required needs assessments in our system that are required by our federal partners to say, okay, how would we go about updating this and plan for the development of a replicable needs assessment that really would tackle the unanswered questions in our system and build capacity of state government to really be collecting that high quality data to inform decision making. So likely some systematic data gathering, listening sessions, and focus groups across the state to inform the next replicable or updated needs assessment, and then using that to inform the next activity, which is the strategic plan. Next slide, please. So again, under the original grant, we had the ability to update the Vermont Early Childhood Action Plan. So the visual you're seeing on the left-hand side of the screen is our vision and strategy for Vermont's early childhood system. Again, a role that BBF holds in state and federal statute. We articulated 4 critical goals to be moving towards by 2026. And we've seen such tremendous and exciting progress in reaching those goals. We've seen a really exciting ability to monitor our system through this strategic plan and to develop partnerships to move towards those goals. And that this grant provides us funding to do the next iteration of that work, which is, as we are implementing this strategic plan over the next year and a half, that we are identifying new needs and thinking about how we update this strategic plan to set the next 5-year vision. So we will be embarking on, again, continued implementation of this grant, but then identifying opportunities to address the inequities, really thinking about developing the next iteration and what that stakeholder engagement process looks like to update that strategic plan in 2025. And that will likely involve crosswalking, indicator review, and needs assessment data. The third activity in the VIP B5 project is maximizing family choice, engagement, and family leadership. There are several projects in this scope of work. BBF is leading one of those. And this is really about strengthening our capacity in Vermont to improve engagement and leadership opportunities by building a stronger infrastructure for families to be engaged. So we are prioritizing the infrastructure of the Families and Communities Committee, which is one of our strategic plan committees, and thinking about how we continue to provide opportunities for families to play a key role in statewide decision-making, in training and leadership development opportunities. We are hiring a family leadership coordinator to help support that body of work, and partnering with a range of different folks to be producing an inventory of what exists in the family leadership and engagement landscape. Where are there opportunities across the state? What resources exist? How are we making those connections and communicating about those opportunities statewide? Next slide.
I'm going to share two of the projects under Activity 3, Maximizing Family Choice, Engagement, and Leadership. The first is supporting and sustaining our Help Me Grow system. And here we're really seeking to support that early relational health, the key foundations that support children's development and well-being, by providing high quality information, and that's child development information, as well as parenting information on social and emotional skills and how to promote those. We use the Center for Disease and Prevention's Learn the Signs Act Early milestone materials, as well as other high quality evidence-based materials. And we're looking to expand access to resources and services across the state through this centralized information and referral system. Help Me Grow maintains a database of over 3,000 programs and services across the state, and work in collaboration with state partners and programs to ensure that children who need IDEA services like Part B or Part C get connected to those services. And we offer a closed loop referral process. We follow up with families. We provide ongoing care coordination to make sure that families get connected to the service, whatever it is. And then we also promote developmental screening through offering training in the ages and stages questionnaires, both the general development and social emotional tools, free of service. We also host the ASQ online platform for the state, and have really increased use over the past few years throughout the pandemic. Now we have over 59 programs enrolled in the ASQ online, and over 14,000 screens entered in that system. And this system will be integrated with our Universal Developmental Screening System, which is a statewide data collection and communication system at the health department. And this is part of our data integration efforts under PDG. And I'm going to also talk about touch points, which is a very strengths-based, relationship-based approach. Vermont has stood up a touch points training center. I'm very excited about this work. We have key partners in this work of the Vermont Child Health Improvement Program, as well as we'll be partnering with Northern Lights Professional Development to offer professional development credit and align that with the STARS revision efforts and quality improvement coaches. We've developed a cadre of touch points facilitators and trainers, and looking to expand trainings over this next year. We trained 2 cohorts, including statewide CIS providers, as well as a cross-sector program, a variety of programs coming together up in the Northeast Kingdom, and really looking to expand this work and get more information out about it to folks.
What are they doing?
Okay. Activity 4 is around identifying barriers to recruiting the early childhood workforce. We recognize that this is an issue that is impacting everybody in the state who's trying to meet the needs of young children and their families across sort of all elements within the early childhood settings. The specific projects that are within the preschool development grant are related to early childhood education and childcare settings. So the first project is to conduct an evaluation of the early childhood education apprenticeship program and to look at how that program can be updated, adapted, expanded to meet a wider variety of aspiring early childhood educators and help them on their professional journey through an embedded work-based program that includes college coursework as well. So excited about that piece. And then the next one is around the background checks and fingerprinting. We are deeply aware of what a challenge this is every day in the field. While we're trying to work on it now, this grant will allow us to have some expanded capacity so that we can work even more closely with partners within the Department of Public Safety and across agencies to identify strategies that can help get this unstuck. Okay. So, and the next activity is around expanding access to high quality professional development. And so this is continuing to deepen and strengthen the work that's been already happening within the state around increasing equity, inclusion, and trauma responsive approaches within the trainings that are offered and the professional development opportunities that are offered, sponsored by Northern Lights. We also are going to implement the match registry, which is, and other people are going to remember this off the top of their heads, and I am not going to remember what the mentoring, advising, training, coaching, and another one. And helpers, like helping, is that really what it is? Okay. So the match registry, so this is for the professionals who are offering the trainings and coaching and support. And the goal of the registry is to help programs be able to be connected to those professionals more easily by being able to identify who's the specialist, who offers in the topics that I'm interested in. And then finally, again, related to the first bullet is specifically expanding those training offerings related to access, equity, and inclusion, which we know is a priority for all of us.
I'm very excited to introduce the early MTSS, early multi-tiered system of support implementation interagency project. This is a collaboration between CDD and AOE. Early MTSS is an evidence-based, data-driven, practice-based coaching model, which promotes those policies and practices that advance equity, diversity, and full inclusion and participation of each and every child in their community, in their school or program, and in their home. The training and coaching is focused on positive social, emotional, and behavioral outcomes of young children birth to age 5. And that includes universal practices such as nurturing and responsive relationships and high quality environments, targeted social and emotional supports, family engagement, use of data for decision making, reducing the likelihood of challenging behaviors, and the use of exclusionary discipline like suspension and expulsion is also a hopeful outcome, and fostering inclusion of children with and at risk for developmental delays and disabilities. It also uses a very trauma responsive approach. This project builds on the statewide infrastructure that was established under the Race to the Top Early Learning Challenge grant, the PDG planning grant, and practice that Vermont has had in place for the last over 10 to 15 years. And what this project will do will expand on a cadre of early MTSS implementation system-based coaches, which is imperative for sustainability and positive outcomes. We'll look at expanding state capacity across a variety of early childhood, childcare and education settings, such as childcare, Head Start, early childhood and family mental health, public and private UPK programs, to name a few. The funding, scale up, and sustainability of early MTSS professional development, training, and coaching for those social emotional impairment practices. So we're really looking at establishing and maintaining state, regional, and local early MTSS leadership teams, developing that infrastructure needed to support that expansion, the spread and scale of early MTSS, including state, regional, early MTSS implementation coaches, practice-based coaches, trainers, match registry, etc. And expand demonstration and implementation sites across diverse ECCE settings, prioritizing highly a robust model of evaluating program fidelity using an improvement, a comprehensive quality improvement lens. Next slide.
Hey, under workforce development, we are expanding our early care and education health consultation. And this is work that we stood up under the Early Learning Challenge Race to the Top grant, and we continued to support this throughout the pandemic, partnership with Let's Grow Kids. We're going to expand that with this opportunity to align with Northern Lights and offer professional development credit for webinars and web-based information, as well as align with QRIS and the STARS revision process quality improvement coaches that for some on-site consultation and visits. I'm really excited to revive this work and expand it.
Mm-hmm. 4.5 is the improving professional development and quality using the Vermont Early Learning Standards, also known as the VELS, over a 3-year period. The VELS describe the knowledge and abilities children should have from infant, toddler, preschool, kindergarten through grade 3. In 2015, the VELS were expanded. Before that, we did not have infant and toddler standards. So it's pretty cool to look at some engineering standards for babies. And the social, emotional, and play are also embedded in the VELS. UPK Act 166, Universal Pre-K Education Law requires all universal pre-kindergarten education programs to align the curriculum instruction with the VELS, child care licensing regulations in terms of ensuring age-appropriate planning, curriculum, instruction, and assessment of child progress, and our QRIS system. VELS is important in that capacity as well. And they're also written for families. So the AOE will support program quality and the use of VELS by improving our VELS website navigation, updating the standards with multiple national organizations, and providing training to staff on the website maintenance, promoting VELS and messaging to ECCE professionals and families. There will be a development of 4 interactive e-learning modules that are for administrators, educators, and families. We are hoping that hard copies of the VELS can roll out, and the VELS calendars, which again, VELS was a project under the Race to the Top Early Learning Challenge grant, and funds were used to distribute calendars for families. And also we partnering, which is crucial with Northern Lights at CCV, to ensure that professional development opportunities are messaged properly to the field, and recognition of professional development completion of VELS training is recorded and aligned. Next slide. 4.6 is provisional license mentoring, which is also under the Agency of Education. We know that our early childhood education workforce is in crisis. And this has been a challenge that has been really exasperated by COVID-19. So specific to universal pre-K, Vermont Act 166 requires each licensed provider to employ or contract for the services of at least one teacher who is licensed and endorsed in early childhood education or early childhood special education. In March 2021, the Standards Board for Professional Educators, VSBPE, approved an AOE early childhood education, early childhood special ed provisional license waiver, specifically for qualifying individuals who are employed or contracted with private pre-Ks as a one way to address the shortage of early childhood educators and pre-K programs. This provisional license waiver requires licensed early childhood educators, early childhood special educators, mentors to support, coach, and advise the educators with provisional licenses as part of the educator licensing process. And over the past 2 years, we've had 58 VSBPE, ECE provisional license waivers have been approved, with 10 superintendent approved provisional license for a total of 68 total provisional license for private universal pre-K programs, which is huge. And on February 9th, we were happy, our universal pre-K coordinator presented to the VSBPE, Wendy Scott, and the VSBPE approved the AOE, ECE, ECSE provisional license for private pre-kindergarten programs policy, say that 5 times fast, for the following years for cohort 3 under this project, 2023 to 2025, and another cohort that would go from 2024 to 2026. So this project really addresses the need to recruit and retain new mentors to support early childhood education and early childhood special ed providers through the licensing process, through coaching and advisement, while also promoting the early childhood profession statewide. Funds will also build the capacity to manage the required mentorship components, including connecting mentors with mentees, dissemination of contracts, stipends, and monthly technical assistant meetings and collaboration with the AOE UPK coordinator.
So the next body of work is under activity 5, which is moving into our quality space. And 5.1 is continuous quality improvement and monitoring in universal pre-kindergarten education, which is an interagency effort. Katie, do you want to speak to this one with Janet?
Sure, thank you. So this project is based on ensuring cross-agency collaboration and coordination, aligned vision and strategy, and strong partnerships to monitor through the UPK Accountability and Continuous Improvement Monitoring System, also known as UPK Access, across our mixed delivery system. The highlight of this is the addition of 2 new positions, one at the AOE and one at CDD. Currently, there is one access coordinator who is at the AOE, Leslie Friedman, and no counterpart at CDD. So this additional staffing is really going to support that development and implementation of high quality UPK data collection and analysis, quality improvement efforts with UPK programs, supporting the educators and staff and better communications between agencies, and also increase that capacity to better serve the field. We recognize that need to come up with innovative solutions in reducing duplication and streamlining fingerprinting and background checks where it's permissible, and increasing that agency capacity is really necessary to help with those kind of issues that are coming up. This is really going to help us with that, improving that school readiness and the quality of over the 420 plus UPK programs that, that we can build capacity and support.
Great. Yes, we are really excited about the last activity and to partner with AOE around Universal Pre-Kindergarten, in the ways that we know are, supportive of our shared goals of meeting the needs of young children and their families. This next project does that as well. We are around continuous quality improvement and monitoring within childcare programs. As many of you know, Vermont's Step Ahead Recognition System, STARS, is getting a makeover. It has been reimagined in ways that I think are really exciting in order to more clearly define what we mean by quality and to ensure that the process is equitable and accessible, is aligned with best practice, and is really rooted in continuous quality improvement. So this grant will allow us to be able to do that work more robustly and provide the support to programs through this transition and make sure that we're building out the systems of communication and around applications and just seeing this new STARS system through. We're really, hopeful to, we're moving through the rulemaking process right now and it should launch, in July. And we think it's going to be, a significant improvement that allows programs to really identify where it is that they want to really assess where it is that where they are now, identify the places where they'd like to improve, and be able to identify the supports and resources that are going to help them take that next step.
All right. The last project under quality is around data monitoring and integration. And, we've set some very large goals in the state of Vermont for thinking about how we align and integrate early childhood data across all of the sectors. And we're really excited that this grant is building capacity across all of our different agencies, departments, and divisions who are doing early childhood data-like work. So we will be having additional staffing capacity at our different agencies, departments, and divisions, including not just those on the call, but also the Agency of Digital Services and the Office of Racial Equity, and really working towards bringing together these key data stewards and partners to think about how we are developing more high quality ways to collect and analyze and share early childhood data, and then use that data to inform decisions about our system, about our programs, and to be able to use that to monitor our system as a whole. So Building Bright Futures will be leading this scope of work alongside all the partners on the call here today. We'll be reconvening the Early Childhood Data Governance Council, really thinking critically about how we are tackling some of the big early childhood data gaps, and developing strategies to think about how we link early childhood data in the absence of something like an integrated early childhood data system, which we all know we desperately would love. And how do we move this body of work forward and really think collaboratively and critically about how to do that in the interim? This project will also support and full evaluation of the preschool development grant and thinking about how we are evaluating systems change. How do we know if we're making the impacts that we want to for kids and families in which areas, and how do we adapt when change is needed? So I think we can pull down our slide share, and in conclusion for today's webinar, this is such a robust, complicated body of work that has been put together for Vermont's application. We are really working to build a comprehensive early childhood system that meets the needs and really tackle some of the most complex challenges that you all have as stakeholders across the system have identified. I also want to acknowledge that we can't answer every question and tackle every gap in the system, but this was this was a really great effort on behalf of public and private partners to say, here's how we're going to utilize these funds over the next 3 years to set the foundation for our early childhood system. And I think that I hope you heard a range of themes come through as we were presenting today around workforce, around quality, around thinking about integration and collaboration and partnership. Just a quick reminder, we are in the beginning stages of planning and implementing, so there's so much more information from all of the directors' teams and this group to come. And we're really excited to partner with you over the next 3 years to build Vermont's early childhood system. So thank you for attending today.